World AIDS Day was first observed in 1988, making 2023 its 35th anniversary. It was established by the World Health Organization, WHO, and the United Nations, UN, to bring attention to the global AIDS epidemic. The theme for this year, Let Communities Lead, emphasizes the collective effort needed to address health disparities and achieve the ambitious targets set by UNAIDS within Nigeria's borders. HIV remains a major global public health issue, having claimed 40.4 million lives so far, with ongoing transmission in all countries globally. There were an estimated 39 million people living with HIV at the end of 2022, two-thirds of whom, that is around 25.6 million, are in the WHO African region. In 2022, 630,000 people died from HIV-related causes, and 1.3 million people acquired HIV. Joining me now on the news to discuss this is Dr. Olufemi Adeyemi. He's a UNICEF health specialist. He joins us via Zoom, while Mrs. Ibironke Adeoye, Southwest Zonal Coordinator for the National Agency for the Control of AIDS, NACA, is with me in the studio. Ladies and gentlemen, thank you so much for joining me on the news. Dr. Adeyemi, let me start with you. Let's look at UNICEF's approach to addressing HIV/AIDS and how it has evolved over the past several years. What key strategies are currently in place to combat the spread of the virus, particularly among vulnerable populations?
Is what is called the four-pronged approach, primary prevention of HIV. Women, it is on upon this, prevention of gender pregnancy among age of 25 to 60.
Dr. Adeyemi, I apologize. We're going to see if we can sort your audio. Let me go to Mrs. Adeoye, who's in the studio with me. Mrs. Adeoye, let's look at the significant challenges Nigeria particularly faces when it comes to combating HIV/AIDS. What are those challenges for Nigeria, for this country that we are in now?
Thank you for having me. I think one of the challenges is the issue of stigma and discrimination among people living with HIV. Although as a country we have the anti-stigma law and the bill, but we still have stigma and discrimination still happening, even around. People who are positive are still not very confident to disclose their status because they might be discriminated against. So it's one of the challenges. And one other challenge is we Nigerians don't have a good health-seeking behavior. An average Nigerian will not go to the clinic unless he is down with malaria or any other thing. And when you talk about HIV and AIDS, it's important for everyone to know their status, and it can only happen when they are tested. And because people will not go out ordinarily to go and test, because maybe they are afraid of, oh, if I'm positive, what happens? And maybe I'll be discriminated against. But I want to tell them that the moment you are positive, the drugs are free and readily available and accessible.
Okay, so Ms. Adeoye, I want to look at, we've talked now about the challenges, but has there been any success, particularly with Nigeria's fight against HIV/AIDS in our borders? Would you say we've had some progress in the past several decades, if any?
Yes, I think we have made tremendous progress. When the issue of HIV and AIDS first came in, it was like a death sentence. Everyone that was positive was afraid. Number one, because the drugs were not cheap, and it was still new at that point. But now, the moment you are positive, you can start treatment immediately, and the treatment is free and across everywhere. And for the key affected population, the ones that we know are the key population, we have centers that are youth-friendly, that they can access care, they don't have to be discriminated against, they will meet their peers. And it's been eventful because people can go there and get help without any form of discrimination. And talking about pregnant women, though we still have a low coverage, but to a large extent we have pregnant women that are giving birth to negative children, which is a plus for the country.
Dr. Adeyemi, let's see if we can bring you back into the conversation. Are you with me now? Hello, Dr. Olufemi Adeyemi.
Can you hear me now?
Yes, I can hear you. So, much better.
Good afternoon.
Good afternoon. So, I was talking progress with Mrs. Adeoye, and I'd like to get your ideas on progress in the fight against AIDS across the world. Could you share some insights into the progress made in achieving global targets related to HIV prevention, treatments, care for children and adolescents, and even highlight what might remain, what might be the persistent challenges that continue to require urgent attention?
Yeah. Can you hear me now?
I can. Please go ahead.
Yeah, you were talking about the current status of HIV in the world. As far as we are concerned, in the sub-Saharan Africa still contributes the highest overall burden for HIV, of which an estimated 1.54 million children under the age of 15 are living with HIV, out of which 87% of them are actually from the sub-Saharan Africa. In West and Central Africa region, we have there are about 44 new daily HIV infections amongst adolescents, girls between the ages of 15 and 19, and nearly 140 new daily HIV infections among children aged 0 to 14. Yeah, of the 1.2 million pregnant women globally that are living with HIV, 82% of them actually receive medication and receiving drugs to protect them from their health and then prevent transmission of the infection to their babies. That has increased as compared to what we had in 2010, when it was just about 48%. However, this coverage has not really improved so much since 2018, so there's been some element of stagnation. 25% of all pregnant women living with HIV are adolescents aged between 15 and 24 years of age. What do all these figures actually mean? As at 2022, in 2022, every day, it means that more than 380 young people between the ages of 10 and 19 were getting infected with HIV.
Okay.
While for adolescents, adolescent girls continue to be the most at risk, accounting for about 268 daily infections, or 71% of new infection amongst 10 to 19-year-old. That's what we've had.
Okay, Dr. Adeyemi, I apologize for interrupting you. You're sharing some really staggering statistics and some numbers that I think will really lay this out for people. I want to come back to Mrs. Adeoye, because we know how much the COVID-19 pandemic disrupted things. It disrupted things with global trade, with economic trade as well, but many of us underestimates how much it disrupted the healthcare systems across the world. So, Mrs. Adeyemi, let's talk about how we were able to adapt. That's NACA now, able to adapt its HIV/AIDS program to ensure continuity of services and support for affected communities, and bring about innovative measures that have been implemented to mitigate the disruptions coming from the COVID-19 pandemic. Mrs. Adeoye.
All right. Incidentally, during the COVID-19 pandemic, the health services were actually recorded a lot of progress even around that period, because we knew that our people should not be denied access. So at that point, the drugs were actually being taken to their doorsteps. So through the differentiated care model. So we recorded outstanding progress during the COVID-19, because people were still able to access their drugs as free, and it's still accessible even during the COVID-19 pandemic.
And so, you know, with this year's theme, which is Let Communities Lead, I want us to get into that as well, Mrs. Adeoye. In what ways can individuals, and particularly communities, actively contribute to the national efforts in ending HIV/AIDS, particularly in Nigeria? Why is it so important with the WHO and the UN to ensure that communities are part of the fight?
Yeah, thank you very much for the question. Communities are at the center of the epidemic. When you talk about communities, you're looking at people living with HIV and AIDS, you are looking at pregnant women, you are looking at youths and adolescents, who are the drivers of the epidemic, even as we speak. So when they take the center stage, for example, the youths, they know the language, they can speak to have peer education among themselves. they can have symposiums, they can have meetings where they can talk about how they can live healthy, how they can stay away from getting HIV and every other thing. So, and amongst the people living with HIV also, there is a concept called the community-led monitoring, that you see people living with HIV going to the facilities, taking the center seats, looking at how service is being delivered, and ensuring that people are getting the right service without discrimination. So I think this is a good initiative, and it's now looking like the communities are ready to take the center stage so that we can at least end HIV by 2030.
Thank you so much. Let me just get one clarification from you. In this regard, communities doesn't necessarily mean physical spaces. This means gatherings and groups of like-minded people, individuals that share, even if it's age, as you mentioned, young people. So communities can be anything. Am I correct?
You are correct.
Absolutely. Thank you so much. Joining me to look at World AIDS Day today, Dr. Olufemi Adeyemi, UNICEF Health Specialist. Unfortunately, he wasn't able to join us for long. And Ibironke Adeoye, Southwest Zonal Coordinator for the National Agency for the Control of AIDS, NACA, joining me today in the studio. Thank you so much.
Thank you.
Thank you.